It's really common that after patients see me in the office and they decide to start hormone therapy, the next question they ask me is, Dr. Hirsch, how long can I take this for? And not only is that a common question, but a lot of times I see consults for women who have been taken off their hormone therapy because a magical birthday happened. Perhaps they turned 60 or 65 and their doctor told them they had to come off or they had to wean off their hormone therapy, and now they feel miserable. So in this video, I'm going to answer the question of how long can you take hormone therapy, and then I'm going to discuss 3 things that you need to talk about with your clinician every year when you continue your hormone therapy. Now, we're not going to waste any time in this week's video because I'm going to get straight to the answer. And the answer is that there is no longer any time limit to the use of hormone therapy. And this is not breaking news. This actually has been out for a couple of years. And I am going to back this statement up by showing you that NAMS, the North American Menopause Society, has a position statement also stating that there is no time limit to the use of hormone therapy. And not only NAMS, but ACOG, or the American College of OBGYN, also stands for this recommendation that there is no longer any time limit at which you must stop hormone therapy. So I usually say in my clinic, I sort of have 2 spectrums and a bunch of women in between. On one hand, I have women who say, please don't take my hormone therapy from my cold, dead hands. And if that's you, comment below, because I would love to know how many of you have taken hormone therapy for many, many, many years, and if your doctor has tried to, lure you or wean you off. At the same time, I also have women who say, every year I would like to try to decrease my dose and see if I can come off and see how I feel. And there is no right or wrong answer. But just because a magical birthday happened does not mean that you have to stop your hormone therapy. So why do a lot of doctors think this is the case? Well, a lot of this stems from the Women's Health Initiative, or the WHI for short, which was a randomized controlled trial on hormone therapy that was done in the late 1990s and then completed in the early 2000s. And what they found in this study is that post-hoc analysis showed that women who were within 10 years of menopause who took hormone therapy did particularly well, and that the risks really started to outweigh the benefits if it had been 1, but especially 2 decades, so 20 years since your last menstrual period. And so then the idea was, well, if you're 1 decade or 2 decades after menopause, which is on average, age 60 and age 70 respectively, well, that's when the risks outweigh the benefits and you need to stop. But what they didn't take into account was that in the study, that was the age at which the women started on their hormone therapy. So if you start your hormone therapy within the first 10 years of your last menstrual period, then you can take your hormone therapy for as long as you would like. Now, the biggest risk of hormone therapy is the rare risk of a blood clot, which is the highest in the first 6 months after you start. So if you've spent, 10 years, 15 years, and you haven't had a blood clot, chances are you're probably not. The other question people ask me about is, well, will my risk of breast cancer increase with each year? And there is no real data to show that, because really your risk of breast cancer increases each year as you age, whether you're on hormone therapy or not, because age is the biggest risk factor for breast cancer, which, may I remind you, is 1 in 8 in the general population. So again, just for the record, both NAMS and ACOG state that there is no longer any time limit at which you must stop your hormone therapy. And I'm going to drop the link to this in the description bar below so that if you want to print it out and take it with you to your doctor, you can. So what are the 3 things that I recommend discussing with your doctor each year that you're on your hormone therapy? Number 1 is, do you have any new medical history? Do you have any new medical diagnoses? And if you don't have any new medical diagnoses, is there any new symptoms that are currently being worked up? Because that could certainly play a role in perhaps your dose or the route of your hormone therapy. So every year I certainly do a review of what my patients have been up to, of course socially, but also medically, because that is really important information to know to synthesize and to take in on how we're going to proceed with their hormone therapy. Along the same lines, number 2 is, have you started any new medications? Now, I certainly want to know that because I want to make sure you're not taking a medication that's going to interfere or interact with your hormone therapy. And I also want to make sure that it's not going to be contraindicated or put you at any adverse event risk. So I want to know about any new medications that you've started over the last year, and not just medications, but supplements or vitamins or anything new in your regimen that you are taking. That could even be something as simple as herbals or teas or things that you're buying on Amazon, because I want to make sure that this is still safe for you while you're on your hormone therapy. And lastly, I want to ask you how you are doing and how your health is currently being prioritized. When we're thinking about starting or stopping hormone therapy, this is a discussion that should be made between you and your clinician, and it should be a shared medical process. And that's the whole point of this video. But each time I'm asking you, how are your symptoms? Are they covered on your current dose? Are you having any adverse events? Are you having any side effects? Are you having any bleeding that I need to know about? And that's going to help me decide if it's still the right dose for you, and if there's any other workup that I need to do each year that I re-prescribe your hormone therapy. I hope that this video was really helpful, and if you gleaned something from this YouTube video, please feel free to subscribe to the channel. It's free to do so. You can always change your mind later, but it is really the place that women are going across the globe to get evidence-based information on all things menopause and midlife. If you don't know me, I'm Dr. Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic and faculty at Harvard Medical School, and it is such an important mission to raise education and awareness about all things midlife and menopause, which I'm doing here through this channel and with your help by subscribing to the channel. If you're new here, check out my free hormone health guide, which you can find in the description bar below. And if you're interested in my new course, definitely you'll want to get on my email list, which you will do if you jump on that free hormone health guide. And you can also follow me over on Instagram. I'm at hormone.health.doc, and there I really let you guys weigh in on a lot of the topics that you want to learn about. And also we're going to do another question and answer when we hit 10K subs over here on my channel, which I'm so excited for. So I let you guys submit to me via Instagram the questions that you want answered. Don't forget to comment below if your doctor made you come off your hormone therapy and how you navigated that situation, because this is also a wonderful community that we're building here. Thank you guys so much for watching, subscribing, and all your comments. I can't always get to all of them, but I certainly do read them, and they really inspire me to make the content that you guys want to learn about. Thank you so much, and I'll see you next week for a brand new video. Bye, everyone.